Deputy Prime Minister and Finance Minister Chrystia Freeland there responding to a question about the NDP's push for single-payer universal pharmacare. The government has committed to introducing framework legislation by March 1st as part of its deal with the NDP, but has not committed to implementing a single-payer universal system. Part of the reason? Money. As you heard there, Freeland is standing by fiscal anchors that likely really limit spending power for a major new program like pharmacare. Here to dig into that and the fiscal situation for the government as it prepares for the next federal budget is Parliamentary Budget Officer Yves Giroux. Hi, Mr. Giroux. Good to see you as always.
Likewise.
I want to start off on pharmacare because you've done some analysis about what it would cost, the government's bottom line. If they do go with a single-payer universal system, what is the associated cost in your estimation?
Well, the associated cost depends in large part on the number of drugs that would be covered. So we ran a simulation, or we estimated the cost of a program that would cover the same drugs as the Quebec insurance plan, and we estimate the cost, if that was to be offered nationally, at $11 billion per year, rising with population growth and inflation. So minimum $11 billion per year.
Can you contextualize that against other big line items for the government? How significant would that be for government spending?
That would be fairly significant. For example, for the National Defense entire department, we're spending about $25 billion per year, and that's for bases across the country, tens of thousands of Canadian Armed Forces personnel, plus thousands of civilian personnel. So it would be a significant amount of money.
Often when you ask the NDP, for example, the party really pushing for this to be implemented, about the cost, they push back with that it would save Canadians, understandably. Obviously, if we're getting our drugs covered, that saves me some money, or whomever is covered, it will save them some money. You also did some analysis about what savings would look like. What did you come up with there?
Well, we estimated that the negotiating power that the single payer would have could lead to savings of about $2 to $3 billion per year, if memory serves me well, which is not insignificant. But you have to keep in mind that a single payer would also displace other private insurers that currently provide coverage for those who have an employer who provides that type of coverage. And there's also an unknown in that costing. So we don't know exactly what would happen with provinces that currently provide coverage to certain populations. For example, those on social assistance, children, or seniors who are covered by provincial plans, some provincial plans. So there's uncertainty as to what would happen with that.
When the minister was asked in the clip that we played about sort of the fiscal room for this kind of program right now, she pointed to the two fiscal anchors she had outlined for the first time in a long time, actually, in the fall economic statement. One of them is about debt to GDP. The other is keeping the deficit as a portion of GDP below 1%. I think you had mentioned just before we started that doesn't start until 2026. How limiting do you anticipate those two things to be for the government's budget and their ability to spend on big programs?
Well, the declining debt to GDP ratio, that's already been busted because the debt to GDP ratio has increased. Last year, I think, and this year, it's still above the level at which it was when the government started talking about a declining debt to GDP ratio. That's probably why the government is also talking about a deficit of 1% of GDP or less starting in 2026-27, because that's out in the future. That being said, if the government was to implement a national pharmacare program, single payer, as was talked about, that would be very difficult to make that jive while respecting the 1% of the deficit at 1% of GDP or below, without cutting elsewhere or increasing taxes.
And what about cutting? Because you've done some preliminary analysis as well. The government in the last budget talked about, $15 billion over a certain number of years, 3%, but again, starting a bit later and over a number of years. I think that what you've already seen is that so far they've just identified $500 million of cuts, correct? And what is your assessment of basically how much room they have to cut without impacting services?
There's probably a significant room for maneuver to cut or reduce spending without affecting services, because the public service has grown at a rapid pace over the last several years. However, when the government has introduced previous measures to reduce spending, it doesn't have a good record of implementing the expenditure reductions that they've announced. For example, I think it's 2 years ago, they were promising savings, but they took previous year's savings and counted that instead of doing the real savings or cuts that they promised would happen the next year. So there's there's announcements and then there are the results, and I'm not sure both are closely aligned in all circumstances.
Just one quick question then for you as we look ahead to the budget. When they promised in the last budget the full sort of size of the cuts, when do you anticipate to see those actually start to roll out, if they do?
We should see results, or we should have details fairly soon, because if they really want to have reductions or realignment in spending, departments need to have time to implement them to ensure that they can materialize. So in the budget, we should have details, if not before. I'm hoping.
Okay, we're all hoping. More information is good. Mr. Giroux, I appreciate your time today.
Always a pleasure.
Parliamentary Budget Officer Yves Giroux.